welcome back to Medical Coding with Blue. Today's episode is all about how to prepare yourself for the CCS exam. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, the CCS, the gold standard of medical coding credentials. This says that you have mastered inpatient coding and outpatient coding. Now, if you are just starting your journey and you went through a program that prepared you and they say you have the option to take the CCA or the CCS, and because we taught you everything that you need to know. The thing that you should know when you're deciding between the CCA and the CCS, both of them are difficult exams, yes. However, the CCS is a longer exam. It is 4 hours, and the questions on that exam are between 115 and 140 questions. So that's something that you need to think about. The CCA is a 2-hour exam. Now, these are both worthwhile credentials. Obviously, you know, the mastery means that you know. There's obviously going to be more opportunities because, again, that person who possesses the CCS has demonstrated the mastery of inpatient and outpatient coding. Whichever one you choose, but I will say to choose wisely because when you're having to pay for exams out of pocket, you want to make sure that you are going to be prepared. So hopefully my message today will help you to prepare and get you going on the right track. But if you are going to sit for the CCS, just know that, of course, it is a timed exam. It is 4 hours, and again, between 115 and 140 questions. We don't know how many questions we're going to get until we get into the room. And these tests are administered at Pearson VUE. You cannot take these at home. You cannot flag, tab, or go back on any of these questions either. You have to answer the question and move on. So that's something else that you have to know. And it goes by very quick, those 4 hours. But I will read to you from the CCS outline. 51.9% of this exam is coding knowledge and skills. So you really do have to make sure that you're prepared with the coding part, okay? Looking up the codes, applying all of those things you have to know, right? Sequencing. The second domain is coding documentation, 10.1%. Provider queries is 8.9%. Regulatory compliance is 29.1%. So another very heavily weighted domain. There's only 4 domains, okay? So that's what you have to know. That's the outline of what is on this exam. Now, I will be leaving this particular PDF link in the description box below so that way you guys can see it for yourself. But you do have to know on that coding knowledge and skills, you have to apply diagnosis and procedure codes based on provider's documentation in the health record, determine principal/primary diagnosis and procedure, apply coding conventions, guidelines, and regulatory guidance, apply CPT/HCPCS modifiers to outpatient procedures, sequence diagnoses and procedures, apply present on admission guidelines, address coding edits, assign reimbursement classifications, abstract pertinent data from the health record, and recognize major complication/comorbidity, MCC, and complication and comorbidity, CC. So those are the things that that's the bulk of this exam, 51.9% of this exam. So how do we get there? How do we start to study for this exam and to prepare ourselves so that we can be ready by the time we go into this room? It does not matter if you are a full-time employee where you work 40 hours a week. You have to spend 20 hours per week studying if you want to be successful with this exam. I have known many, many people who thought that they could spend 5 hours per week studying and then they're surprised when they don't pass the CCS exam. You have to spend time getting to know these books and getting practice with them. 20 hours per week. This is not negotiable. This is a priority for a very short span of time, just while you are studying. Now, if you have completed your program, and I've mentioned that if you want to take your exam within 30 days, that's great. That means you've been studying like you're supposed to the whole way through the school. But if you want to tack on another 3 months after you graduate and to study 20 hours per week, and you're like, okay, Blue, I'm going to do this, and I'm going to find out all the things that I wasn't very good at, and I'm going to really study on those. If you want to do that, that's okay too. I always recommend at least no more than 3 months after you've completed your program, because then after a while you're going to start to forget things if you don't continue to study and prepare yourself for this exam. So while you're having those 20 hours per week, right, you should be reading your coding guidelines once per week. They are downloadable from the CMS website. I've left that link so many times. I even leave it in the description box below. And you can listen to those guidelines. You can listen to them while you're doing work around the house or cleaning or cooking. And make sure that you take your breaks, because that's very important when it comes to pacing yourself during this part of your preparation for the CCS exam. Now, in this time, you do have to be working with the workbooks. Do I recommend the CCS prep guide from AHIMA? No, I do not. Only because a lot of people have found themselves very dependent on that book, and they get very upset because they say, oh, I memorized all those questions and none of those questions were in the test. They're not supposed to be, because if they were, then everybody could pass. So the pool of questions is about 1 million, and I say that facetiously, but it's about 1 million questions that's in that pool bank. So whenever you go to the Pearson View Center, these are individual tests. I mean, no one has the same exact test. That's the way AHIMA has it set up. So, you have to be prepared. Practice with the workbooks. The workbooks, that I recommend are in the description box below. I recommend the CPC study guide to help you to learn the CPT side, because even though it says CPC, we are all tested with the same CPT manual, and AAPC did a fantastic job with that CPC study guide. The other book that I recommend for the ICD-10-CM and ICD-10-PCS portion is the ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers by Nellie Leon Chizen. It's from the American Hospital Association. That is a fantastic book, and that's what I credit to helping me to pass the CCS exam when I took it, okay? So you're going to be working with those two workbooks. Then, if you have the Optum ICD-10 PCS book, the spiral bound version, because you can use that to sit for your exam with. In the back in Appendix M, there are hundreds of procedures you can look up. You should be going through that whole back portion, and you should complete the whole thing before you attempt to sit for that exam. And the reason that I say this is because that's going to give you all that practice. Even though you say, well, Blue, I want to see all the op notes. I want to be able to code from op notes. If you can't find simple diagnoses or simple procedures that are listed in front of you, if you can't find those in the book, why are you trying to look at op notes? Right? So you want to make sure that you are working with looking up those codes, so that way you can get that practice in, and then that way you can be able to spot them when you are reading those big notes, okay? And there's big notes throughout the AHA book, the one by Nellie Leon Chizen, and the one by the CPC study guide. There's plenty of big op notes there. But to practice looking up the books, looking up codes in the books is very important, because that time, those 4 hours, is going to go by really quick. This is a 2-part exam. You have your multiple choice part, and then you have your case studies. And you have to make good use of your time. If you're sitting there not really, knowing where to go in the book, again, you're going to be losing time. If you are writing, tabbing, or highlighting in your books, this is a big no-no, especially for the AHIMA exams. Now, AAPC is a completely different thing, but today I'm talking about AHIMA. If you look in the candidate hand guide, it says homemade tabs are not allowed. Now, the CPT Professional Edition by the AMA does have its own tabs that comes with the book, so you can use those if you want to. I do not recommend them, obviously, because when you're going through the book, it's going to cause you to tear your pages if you're practicing like you're supposed to. And you can't just go in and tape that page either, because Pearson View will go through and look at your books. If you have tape on your books, whiteout or any of those things, or those personal tabs that you made by yourself, they will tell you that that book is not valid for testing purposes. They can tell you that you can't take the test. So make sure that your books are clean. You start using them now when you're studying and looking up codes, and you do this without writing in it, highlighting, or tabbing, then you're going to be good to go. It's the people who think that they need the tabs that is just, why are you even doing it then? Why? Because it wastes so much time. And before you tell me, well, Blue, that's just how I learn, these medical coding manuals are not workbooks. That's why you have workbooks. And you can write and tab and highlight all you want to in the AHA book and in the CPC study guide, as long as you want to. But when it comes to these medical coding manuals, they need to be clean. They need to be clean, because the more you write and clutter up those books, the more you distrust the book, the more the book is not going to help you. The more you learn to trust the book, the more you take the time to literally open up the book and look through all the pages, the better off that you're going to be. But again, it's those people that panic and they say, oh no, I have test anxiety. And I guarantee you, some of those people, it's legitimate. It's a legitimate claim that yes, they do have test anxiety. But for others, it's because you didn't properly prepare. Let's be honest, we're all adults here, and I may be saying things that you don't like, but it's not my job to tell you the things that you like. It's my purpose to help you to pass the certification exam. Again, I'm not somebody who's here trying to sell you a program or trying to sell credentials. I'm here to talk to the future generation of CCS credential holders and tell you that this is what it takes to pass the exam. A lot of people fail this exam, and those scores, those pass-fail scores from AHIMA show it. I think it was 55% was first-time test takers from last year that passed in the first try, and that's pretty low. It's pretty low, guys. So take the time to read those. Look at this this exam outline, and look at the things that you need to really kind of pay attention to. If compliance or regulatory is a problem for you, I do have the book that I recommend. There's the affiliate link in the description box below. You don't have to click on it because the title is there. You can look for it anywhere you find your books. The Law, Liability, and Ethics for Medical Office Professionals is a great read, and it's going to cover everything that you need to know. You can also find some additional resources on the AHIMA website, like about physician queries and things like that. That's another really great thing to read. You can go to the CMS website, cms.gov, and you could be able to find lots of information there. And please don't tell me, Blue, it's too big of a website, I can't find it. You spend a little bit of time and you go into that little, like a little magnifying glass box, and you type in whatever you need to, like HIPAA or whatever you want to look at, and you type that in and you'll see a lot of it pop up. All those articles pop up. If you need to, just Google, You can also look at YouTube and type in HIPAA, and you'll be able to see videos pop up about that as well. Something that it will help if somebody else is explaining it to you rather than you reading it. But the purpose of reading during this time when you are preparing for your exam is to help you to become a faster reader. I hear from people time and time again who have failed because they said that they read too slow, and that was their problem, that was their downfall. And when I ask them, how many hours per week did you study? And they tell me, I was only studying 5, maybe 6, and that tells me they were doing about half of that. Don't be that person, guys. Do not. Take this seriously. If you want to pass this exam, you will take it seriously. And you will take the time to practice looking up the codes. And that's the simple part of it. It is literally the simple part of it, is just taking the time to look up those codes. And the more you have that practice with looking up codes, the more you'll see the interior of this book and be like, oh, this says this and this says this. And you'll be able to recall things a lot easier. Because the AHIMA exams are about recall. It's about recall and, of course, application. So that's something that you have to think about. It's not about like memorizing. Sometimes people will say, well, Blue, I'm going to memorize the guidelines. Why would you do that when you can take the guidelines in there with you? Because they're in the book. So you don't need to do that. What you need to make sure that you understand, of course, medical terminology, anatomy, pathophysiology. You need to make sure that you at least have that base understanding of that. And then, of course, going through the books. And Optum, this is not an ad for Optum, but you know, guys, I always recommend Optum, and I recommend them for a reason. They are the most comprehensive when it comes to their version of the ICD-10-CM and, of course, the ICD-10-PCS. And when you take the time to look through them, especially the ICD-10-CM book, before every single chapter, it has a couple pages at least of examples of how codes from that particular chapter are applied. So you can cover up those answers and look at the question and then test yourself on looking up those codes. So that way you'll be able to know what the answers are, and it'll give you the rationale as to why those are the answers. So that's the great thing about working with the books. So that way you can be more comfortable with the books. You'll know where everything is at, and you will gain speed the more you practice. Because at the end of the day, like I said, it is about speed. You have 4 hours. You have that multiple choice part, and then you have that case studies part. And you got to watch that clock, because by the time you know it, you will be running out of time. And so make sure that you get all the practice in that you can. And if you get stuck on a subject, if you get stuck on a particular thing, like, okay, I'm not really sure about this type of coding, or gastro, I always get, confused, or, whatever. Find a mentor or find a tutor, somebody that will help you to be able to understand these things. And sometimes you may have to put out a few bucks, but if you have to put out a few bucks, you have to put out a few bucks. It's just because you're paying for that person's time. There's plenty of tutors on LinkedIn. I'm a tutor myself. My rate and contact information is in the description box below. So that's the thing that I would say most importantly about that. This is a priority. This is not a question about, oh, it's negotiable that I should study 20 hours per week. It's not negotiable, guys. And when you start learning that part, when you start adhering to that, then you'll see a difference in, your understanding of the subject and things like that. Even if you're listening to the guidelines, that's still considered study time. 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes on your drive home, you could be listening to something. There's tons of channels on YouTube that talk about medical terminology, anatomy, and pathophysiology. Crash Course is my favorite one, okay? So listen to them while you're driving. You can listen, guys. Listening is part of the study process. And then when you get home, you do 1 hour of working with the workbook, and you do another hour of working with the other workbook. When at the end of the day, that's 3.5 hours that you've done in 1 day of study. And that did not impact your time with your family, your kids, your spouse, your loved one. It did not impact the time at all. And you do 3.5 hours for 5 days, that's 17.5 hours by the end of the week. And then on Saturday, all you have is 2.5 hours to study, and that's it. And that way of studying is a lot more slower, but it's going to stick rather than being reactive. I talked earlier this week about being reactive versus proactive studying. And so when you think about it, the more you are relaxed and the more you're going to gain confidence. And so then when you do walk into the Pearson VUE Testing Center and you're ready to take that test, then you're going to know that I'm ready because I did everything that I could to prepare myself. And then now it's just going to be the result. So, that's something that you can do. But please don't be these people that do not take this seriously. Then they panic. Then they get to the testing center and then they don't pass because they panic because they didn't study enough. 20 hours per week is all you need. And working through your code books and then working through the workbooks is going to help you. I also have my Patreon channel. Patreon is a lot like YouTube, but I do exercises there, and we have a once a month live study hall. And so this month for July 2023, it's going to be on Thursday the 20th at 4 p.m. Pacific Standard Time, 6 p.m. Central Standard Time, and 7 p.m. Eastern Standard Time. And for my Patreons during this time, we get together and we talk about coding questions and we work it out in the book. And so if you are stuck, that's always an alternative. The minimum pledge is $10 per month. You do not have to subscribe past a month, but if you do, you have access, of course, to anything and everything that I post. Okay, so that's just an option out there for you. But work through the workbooks, the ICD-10-CM and ICD-10-PCS Coding Handbook with the answers by Nellie Leon Chizen, and with the CPC Study Guide from AAPC. That's going to cover the 3 things that you need to know: ICD-10-CM, ICD-10-PCS, and CPT. With those 2 books, they're going to cover all 3 of the main things about medical coding that you need to know. Okay, so that's a great way to start, and make sure that you stick with it. Again, don't be dependent on the CCS study guide, okay? Because, again, those questions are not going to be on the exam. And do not take it for granted that, oh, well, if I fail, I could just take it again. You want to pass on the first try. And again, you want to apply yourself. And don't be scared of it. Because once you have done all of this studying, and then you get to the testing center, then it's going to be like, okay, this is just a review. I've got my books with me. I've trusted them. I've learned to trust them. And we're going to get through this together. So at least that's just my advice anyway. But that's my episode for today, guys. I've done plenty of episodes about what links I recommend as well. So be sure to look through my videos. And again, if you are struggling with medical terminology, make sure that you study that. And again, all of those that I recommend are in the description box below. All you have to do is you see me talking, and then you see the title of the show, and then you see where it starts writing. I have my disclaimer, and you click in that area right there, and all the description will come up, and it's got everything. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Best of luck to you. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.